Hi, my name is Yannick. I'm one of the nurse injector here at Sparkle Lifestyle and Medispa, and I'm here to answer some questions about our CO2 laser.
So first, what is the CO2 laser?
So the CO2 laser is a invasive ablative laser type. So what mean is that we're doing a controlled burn on your skin to treat different type of concerns.
What kinds of things can it treat?
So we can treat fine lines, wrinkles, also acne or traumatic scars. It also helps to rejuvenate the skin, so it gives you a much brighter tone. So in that term, it helps with pigmentation. And the other thing I want to mention too is not only for the face, the CO2 can also be done on the neck, the décolleté. I've treated people's on the knee, on the belly for creepy skin. So it is really a wonderful treatment to treat the skin overall, everywhere on the body.
How does it work to do that?
So it works in different level. With our CO2, we have a light, mid, and deep mode, which means we can treat the superficial skin for fine lines and textured. We can also treat more in the mid-level for stronger resurfacing. And when we hit the deeper mode, we're stimulating collagens for more firmer skin.
Is it a safe treatment?
It is a very safe treatment. We're using the CO2 laser here, guided by the company's guidelines. And from the people I've treated, we never had any type of reactions, no extreme burn, for example. Like I said, it is very a controlled burn that we're creating, a controlled injury to stimulate your skin to regenerate itself and also stimulate that collagens.
Why do you think some people are getting burns and scarring from it at other places?
If somebody did got some more scarring or some burn from the laser at another place, it could be that the treatment was too intensive. Consultation is also very important to understand what type of skin do you have. If you have a sensitive skin, we're not going to do it as aggressive treatment for somebody who would have a thicker skin.
How do I prepare before my first treatment of CO2?
So to prepare for the first treatment of CO2, stay out of the sun at least minimum 2 weeks before the CO2 laser so you don't have an active tan or a sunburn. We also ask to stop any exfoliation, retinol, or acid that you would be applying on your face at least a week prior to treatment so your skin is not being inflamed while we're doing these treatments.
Who would not be a good candidate for CO2?
So everybody is a candidate for the CO2. It's just, like I said earlier, depending the route we want to take. Somebody who can tolerate this treatment very fairly. Somebody who has more of a darker type of skin, we can still proceed the treatment, but more carefully. For example, we wouldn't be able to fully treat at all the different layers, or else it could lead to hyperpigmentation. We always want to diminish the activities of your melanocyte that can create those hyperpigmentation after the CO2. And of course, if you're pregnant or breastfeeding, we never recommend to do those type of treatments while you're doing it. Also, if you're on Accutane, we'd like to wait minimum 6 months after you've done your medication, so that way your skin is not inflamed and we're not creating more damage to your skin as well.
What is it like during the treatment? Does it hurt?
So for the treatment, we always apply a good numbing cream for at least 20 to 30 minutes before the treatment, which help alleviate some of the pain. It does not mean that it's not painful at that point. You can still feel a little bit of a prickle or sometimes a lot of heat. We do cool down the skin after the treatment, so you're not getting out of here with the face burning hot. And then afterwards, people usually experience about 1 to 3 days of a sunburn feel like on the treated area.
What do I have to do to take care of my skin after the treatment?
So after a CO2, we send you home with Aquaphor, which is kind of like a little jelly similar as Vaseline that will help to keep your skin hydrated. Also, if there's a crust that forms, it's going to keep that crust moist so that way it doesn't harden and create further scarring. The other thing that we're going to send you home with is a mix of water and vinegar to use at home to disinfect the treated area.
What kind of skincare should I do or not do after a CO2?
So for the first 2 weeks after your CO2, I always recommend my people to not do any skincare other than a gentle cleanser for your face and a moisturizer and a sunblock. After the 2 weeks is complete and you do a follow-up with us, then we can look at restarting the other skincare regimen.
How many CO2 treatments do I need? Is it one and done, or I might need many?
So for most people with one CO2, they're gonna get a great improvement that can be long lasting. We talk about 4 to 6 years of results. But for people who's dealing more with acne scars or traumatic scar, those people might need 2 to 3 treatments to really get those scars to be more smoother and disappeared.
So if I'm interested in this treatment, what do I do next?
So if you're interested in having the CO2 laser done, you can just easily book a consultation with one of us and we'll be gladly able to give you all the informations on the CO2, what to expect afterwards, and also all the pre-treatment care and the post-treatment care. If you're interested, come see me.